Hello all, welcome to my channel. The topic we are going to discuss today is about tuberculosis. Now let us see what is tuberculosis. TB is caused by a bacterium called mycobacterium tuberculosis. I repeat, TB tuberculosis is caused by a bacterium called mycobacterium tuberculosis, belonging to the Mycobacteriaceae family, consisting of about 200 members. Some of the mycobacteria cause disease like TB and leprosy in humans, and others infect a wide range of animals. So, some of the mycobacteria can cause diseases like tuberculosis and leprosy in humans, and some others infect other animals. In humans, TB most commonly affects lungs. Such TB is called pulmonary tuberculosis, but it can also affect other organs, and such tuberculosis are called extrapulmonary tuberculosis. So, in the case of humans, the tuberculosis is basically divided into two. That is the pulmonary tuberculosis, which mainly affects the lungs, and the extrapulmonary tuberculosis, which affects other organs. TB is a very ancient disease and has been documented to have existed in Egypt as early as 3000 BC. So in the ancient time, TB is believed to be had existed in Egypt. Tuberculosis is a treatable and curable disease. So it is a treatable disease. Now let us see how TB is transmitted. TB is spread from person to person through air. So TB is mainly transferred from one person to another through air. When people with lung tuberculosis cough, sneeze or spit, they propel the TB germs into the air. So people with pulmonary TB, when they cough or sneeze or spit, they spread the germs into the air, which causes infection in another person, and the infection gets transmitted. Now let us see some of the common symptoms of TB. Common symptoms of active lung tuberculosis are cough with sputum and blood at times. So sometimes the cough is accompanied by blood. That is a common symptom of TB. Chest pain is another major symptom. Weakness, weight loss, fever and night sweats. All these are major common symptoms of TB. Now let us look at the global impact of tuberculosis. In 2019, 87% of new TB cases occurred in 30 high tuberculosis burden countries. 8 countries accounted for two-thirds of the new TB cases. So in 2019, there was a massive reporting of TB cases. About 87% of new TB cases occurred mainly in 30 high burden countries, and 8 countries accounted for two-thirds of the new TB cases. So 2 by 3 of the newly reported case was mainly in only 8 countries, and these countries are India, Indonesia, China, Philippines, Pakistan, Nigeria, Bangladesh and South Africa. India reported 1.8 million of TB cases between January and December 2020 as compared to 2.4 million the year before. So, in the year 2020, India reported about 1.8 million TB cases. In 2019, MDR-TB remained a public health crisis and health security threat. So, in 2019, MDR-TB remained a public health crisis and it was also a health security threat to India. Now let us see what is MDR-TB. MDR-TB stands for multi-drug resistant tuberculosis. I repeat, MDR-TB stands for multi-drug resistant tuberculosis. MDR-TB is a strain of TB that cannot be treated with the two most powerful first-line treatment and anti-TB drugs. So MDR-TB is a TB that cannot be treated with the conventional treatment style and the usual drugs which are used to treat TB. Extensive drug-resistant tuberculosis (XDR-TB) is a form of TB caused by bacteria that are resistant to several of the most effective anti-TB drugs. Another dangerous variety of TB is that XDR-TB. It stands for extensive drug-resistant TB, and this TB is caused by a bacteria, and this bacteria is resistant to most of the TB drugs. That is the drugs which are used for the treatment of TB. Now let us see about BCG vaccine. BCG vaccine is one of the major vaccines which is used to prevent TB. BCG was developed by two Frenchmen, Albert Calmet and Camille Guerin, by modifying a strain of mycobacterium bovis. It was first used in humans in 1921. So BCG vaccine was discovered by two Frenchmen, Albert Calmet and Camille Guerin, and it was first used in 1921. In India, BCG was first introduced in a limited scale in 1948 and became a part of the National TB Control Program in 1962. So, in the case of India, BCG vaccine was first used in the year 1948 and later it became a part of the National TB Control Program in 1962. Now let us look at some of the global efforts to prevent and control TB. The World Health Organization has launched a joint initiative, Find Treat All #NTB, with the Global Fund and Stop TB Partnership. So the World Health Organization along with Global Fund and Stop TB Partnership has launched a campaign. The name of the campaign is Find Treat All #NTB. This is the campaign. The World Health Organization also releases the Global Tuberculosis Report to get an estimate about the TB situation of the world. Now let us see some of the efforts by India to prevent TB. National Strategic Plan for Tuberculosis Elimination 2017 to 2025. The Nikshay Ecosystem, National TB Information System, Nikshay Poshan Yojana, TB Harega Desh Jeetega campaign. So the major initiatives in India are the National Strategic Plan for Tuberculosis Elimination, and it is conducted from 2017 to 2025. The Nikshay Ecosystem, Nikshay Poshan Yojana, TB Harenga Desh Jeetega campaign. All these are efforts by India to prevent TB. Currently, two vaccines, VPM stands for Vaccine Project Management 1002, and MIP, Mycobacterium indicus prani, have been developed and identified for TB and are under phase 3 clinical trial. So currently VPM 1002 and MIP are the vaccines which have been developed to prevent TB and they are under phase 3 trial. Now let us look at the National Strategic Plan for TB Elimination. It is a framework to guide all the activities of all stakeholders, including the national and the state governments, developmental partners, civil society organizations, international agencies, research institutions, the private sector, and the other stakeholders whose work is relevant to the elimination of TB in India. So, the National Strategic Plan for TB Elimination is a framework which guides all the activities of various stakeholders who play a key role in the elimination of TB in India. Now, let us see the vision of the National Strategic Plan of TB Elimination. The vision is that TB free India with zero deaths, disease and poverty due to tuberculosis. The vision of this program is TB free India with zero deaths, disease and poverty due to tuberculosis. The goal of the program is to achieve a rapid decline in the burden of TB, morbidity and mortality while working towards the elimination of TB in India by 2020. So, the goal of the NSP TB elimination program is to achieve a rapid decline in the TB cases in the country and to eliminate TB by the year 2025. Now let us look at the pillars of the National Strategic Plan for TB elimination. The four pillars are detect, treat, prevent, build. Short form is DTPB. D stands for detect. We should detect the disease first. And second step is treatment. And the third step is prevention, because prevention is always better than cure. And build. We should have the capacity. We should focus on capacity building to prevent such diseases in the future. So the four pillars are detect, treat, prevent and build. Now let us learn about the treatment for tuberculosis. Drug treatment is one of the most efficient ways to treat this infectious disease. So, treatment using drug is one of the most effective way of treating TB. For patients with latent TB infections, doctors generally prescribe an antibiotic called isoniazid for preventing the latent infection from becoming active. Active TB diseases will be deadly if left untreated. So, if TB is left untreated, it will be deadly for the person. The procedure involves taking a combination of ethambutol, INH, pristine, pyrazinamide for a term of 3 months, followed by a mix of INH and pyrazinamide for 12 months. With this, I am ending this lecture. If you like this video, please do subscribe to the channel. Thank you.